A 25-year-old man walked into an emergency room with noticeably swollen eyes. The loose connective tissue surrounding his eyes was visibly saturated with fluid. The attending physician prescribed a standard diuretic, a water pill to clear the fluid, and sent him home. No urine analysis was performed. No one checked his kidney function. He was back in that same ER shortly after. He didn't have an allergy. He had advanced chronic kidney disease, a condition that had been silently leaking protein into his urine for months, if not years. This case illustrates a specific biological trait. The kidneys can lose nearly all their function without ever triggering a pain response. They compensate with extraordinary efficiency until the moment they can't. Right now, approximately 35 million Americans have chronic kidney disease. Notice how 90 of these figures turn gray. That represents the 80 to 90% of those individuals who are currently unaware they have it. Because the kidneys are so efficient at overworking to cover for damaged tissue, you can lose up to 90% of your filtration capacity before you feel a single physical symptom. But there is an early alarm system. The periorbital tissue surrounding your eyes is loose and low pressure, making it highly responsive to the very first changes in your blood protein and fluid balance. By looking closely at these delicate tissues, we can identify signs of stage 1 through stage 3 kidney damage, the specific window where intervention can still alter the trajectory of the disease. The first and most commonly ignored sign of kidney decline is periorbital edema, eyes that are exceptionally puffy immediately upon waking. To understand the cause, we look at the glomeruli, the microscopic filtration units processing your blood. When damaged, they develop perforations. Vital protein molecules that should stay in the blood slip through and are lost in the urine. As blood protein concentration falls, your vascular system loses pressure to hold on to water. When you lie flat overnight, that fluid escapes the vessels, accumulating in the loose tissue around your eyes. This protein loss triggers a non-ocular sign. Exiting molecules create a stable, persistent foam in the toilet bowl that doesn't dissipate after flushing. Morning eye puffiness combined with foamy urine is a direct signal that your kidneys are struggling to retain protein and regulate your fluid dynamics. The second sign involves pulling down your lower eyelid. If the inner tissue appears pale, white, or grayish instead of healthy pink, it indicates anemia. This lack of color reflects a drop in red blood cells. Often, this isn't caused by a lack of iron, but by the kidneys themselves. Healthy kidneys produce a hormone called erythropoietin, or EPO, which signals your bone marrow to produce red blood cells. When kidney function declines, that production signal falls and your red blood cell count drops. A pale inner eyelid is the visual evidence of a failing hormonal connection between your kidneys and your bone marrow. The third sign is xanthelasma, small, raised, yellow cholesterol deposits forming on or around the eyelids. When the kidneys leak protein, the liver attempts to compensate by overproducing lipoproteins. This drives cholesterol levels upward, often leaving these yellow patches as a visible marker of the metabolic shift. The fourth sign is a white or gray opaque band forming along the outer edge of the cornea. Because the kidneys convert vitamin D into its active form, failing function leads to calcium dysregulation. This can cause calcium to deposit in soft tissues where it doesn't belong, including the surface of the eye. These surface markings are clinical clues that the liver and hormonal systems are already reacting to a decline in kidney health. Spotting these eye signs, or noticing you're waking up twice a night to urinate, is a reason to move past visual inspection and get definitive data. 2 inexpensive tests provide the full picture. The eGFR blood test measures your exact filtration speed, while the UACR urine test detects the presence of leaking protein. Together, these tests can mathematically confirm what the eyes are signaling years before the kidneys reach a state of actual failure. The primary driver of kidney damage is chronically elevated blood glucose. High sugar acts mechanically abrasive to the delicate filtration units, damaging them with every pass. Reducing carbohydrate intake, specifically below 50 grams a day, and using intermittent fasting are the most direct ways to lower the glucose and insulin levels that stress the kidneys. You can support the system further with magnesium, vitamin D, and potassium to manage blood pressure, while avoiding NSAIDs like ibuprofen, which can further restrict blood flow to the kidneys. Because your kidneys must filter everything you consume, your daily dietary habits are the most effective tool you have to address the microscopic damage your eyes are warning you about.